Hi, my name is Noelle Stewart. My client is a 29-year-old single white female. She has two children, ages 12 and 15 years old. My client resides in Dayton, Ohio, with her biological mother and her stepfather. She was working as a waitress and recently lost her job due to her use of IV heroin. She was going in late, attending work under the influence, and ultimately lost her position. At that point, her mother referred her to Children's Services, seeking custody of the two children. The mother and stepfather were awarded temporary custody of the two children, and the client was referred for a drug and alcohol assessment by Children's Services. The assessment determined that client's recommended level of care is residential treatment. So she was court-ordered by drug court to follow through with completing treatment in order to work with Children's Services to regain custody of her children. The client presented with a desire to work on coping skills, to manage her cravings for use, to cope with withdrawal symptoms, and also to deal with emotional pain. She was diagnosed with PTSD and anxiety about 5 years ago. She attended mental health treatment for a while. She's not currently receiving any mental health treatment, and she is not on any medication. The intervention that I chose to use with this client is using grounding skills to detach from emotional pain. The session was pulled from a manual I have called Seeking Safety. Grounding skills are a cognitive coping skill. Cognitive coping skills are part of cognitive behavioral therapy. CBT is a combination of cognitive theory and behavioral theory. CBT is often used with substance abuse and PTSD or other co-occurring disorders. CBT assists in the development and the application of coping skills to deal with emotional pain related to trauma or other mental health disorders, including depression, anxiety, and also to deal with cravings for use or to cope with withdrawal symptoms related to a substance use disorder. I hope you enjoy our role play.